Hello, my name is Lisa Garlington, and today I'm going to be doing some patient teaching regarding the disease process of gout. So let's get started. The first thing we're going to talk about is the disease background. It is an inflammatory arthritis, and it affects primarily the metatarso-phalangeal joint or big toe, and it is attributed to elevated levels of uric acid. You can see from the picture exactly where the inflammation would most likely occur, and you can see the redness from the picture and that it would most likely be very painful. Which brings us to signs and symptoms of the disease, which are acute pain in the foot or ankle, trauma, which could be from an injury, and it could start a flare-up. You would most likely have swelling in the joint and then difficulty moving that joint, and then elevated levels of uric acid. Some comorbidities or other diseases or disease processes that could be going on at the same time or contribute to having gout would include high blood pressure, chronic kidney disease, obesity, diabetes, history of heart attack, and history of stroke. I have a little funny here, and it just says you can enjoy diabetes, high cholesterol, and high blood pressure, or you can suffer from good health. Some other risk factors that can be modified are, well, most of them can be modified. The first one is being male. The second is diet, which would include red meat, seafood, alcohol, and sugar-sweetened drinks. Your age, usually over 40, menopause, prescription drugs, certain prescription drugs, and genetics. Pathophysiology of the disease. It starts with the uric acid levels being elevated, which then cause formation of crystals, and those are centered around the joint, and this whole process of the elevated uric acid and then the crystals is a result of overproduction from hepatic metabolism, meaning that the liver is metabolizing too much, or under excretion by the kidneys, meaning the kidneys are not getting rid of the uric acid like they should. The gold standard for diagnosing gout is synovial fluid aspiration, meaning using a needle to pull fluid from the joint area, and then that would be identified under a microscope, and you would see small skinny crystal formations. Another test that we would do is we could look at blood levels of uric acid, and we would be looking for them to be greater than 6 milligrams per deciliter. Normal ranges for males and females are a little different. Females are slightly lower than males. However, the uric acid levels can be elevated without the diagnosis of gout. It could be caused for another reason, for another disease process, or caused by something else. So that's not the hard and fast. This is how we're diagnosing it, just by the elevated uric acid levels. Treatment options include NSAIDs like ibuprofen, Aleve. Colchicine is an anti-inflammatory drug used specifically for gout, and then corticosteroids are also an anti-inflammatory. Another way that we can improve these symptoms is through weight loss and diet modification, and then urate lowering drugs are also an option. Other diagnoses that are possible are septic arthritis, inflammatory arthritis, so really just the whole gamut of arthritis diagnoses, but really just looking at synovial fluid under the microscope is going to be the one way that we are going to diagnose it. And then there's also 7 variables that a lot of family practitioners will use, and if the criteria is met for 4 out of those 7, then they will go ahead and say that yes, you have gout without having to do the aspiration. So I hope you have learned something today about gout, and thank you very much for your time.